A very warm good morning. So, the topics I'm going to discuss today are triglycerides in health and disease, phospholipids in health and disease, hyperlipidemia, hypolipoproteinemia, Gaucher's disease, Tay-Sachs disease, and Niemann-Pick disease. So, the first topic is triglycerides in health and disease. So, what is triglyceride? Triglycerides are a fat which is found in our blood. When we consume something, our body converts these calories which it doesn't need. So triglycerides are stored in the fat cells. Now, triglyceride in health. The first point is exercise regularly. That is at least 30 minutes a day. Regular exercises can lower this triglyceride and they boost the good cholesterol. Next is avoid sugar. By avoiding the sugar and carbohydrate can also lower the triglycerides. Next is lose weight. By losing the weight, you can also lower the triglyceride. If you have this hypertriglyceridemia, focus on cutting the calories. When we have extra calories in our body, they converts this triglyceride and stored as fat. So by reducing the calories will reduces the triglycerides. Next is choose healthier fat. That is, try to consume a healthier fat. For example, fat which is found in plants like olive and canola oil. Limit how much alcohol you drink. People who are suffering from this hypertriglyceridemia must avoid alcohol because this alcohol contains high calories and sugar. Now, triglycerides in disease. This high triglyceride may contribute to hardening of the arteries or thickening of the artery walls, with increasing the risk of stroke, heart attacks and heart diseases. Extreme high triglyceride can also cause this acute inflammation of the pancreas. High triglycerides can be a sign of type 2 diabetes, metabolic syndrome, low level of thyroid hormone. Metabolic syndrome is a condition when high blood pressure, obesity and high blood sugar occur together, increasing your risk of heart diseases. Low level of thyroid hormones, that is hypothyroidism, certain rare genetic conditions that affect how your body converts fat to energy. High triglycerides are a side effect of taking certain medications such as estrogen and progestin, retinoid, steroids, beta blockers, immunosuppressants and HIV medications. Next topic is phospholipid in health and disease. So what is phospholipid? It's a complex lipid with fatty acid, alcohol, phosphoric acid and nitrogenous base. A lipid molecule in which one of the alcoholic group is esterified to phosphoric acid molecule and the other to carboxylic acid are called phospholipids. So this phospholipid play an important role in protecting the cells and organelles. So they are the signaling mediators for various biological processes, and this phospholipid and their metabolites in the tissue are associated with various human diseases such as cancer, cardiovascular diseases, diabetes, Alzheimer's and autoimmune inflammatory diseases. The three main roles of these phospholipids are, the first one is they are the major compound of cellular and organelle membranes, and the second is they are the signaling mediators in various cellular processes, and the third is they are the member of energy storage. We are moving to the next topic, that is hyperlipidemia. This hyperlipidemia is also known as high cholesterol. So hyperlipidemia can be defined as several disorders that result in too much fat in the blood. So this lipid can enter the wall of arteries and causes the risk of developing hardening of the arteries, which could causes hyperlipidemia complications such as heart diseases or stroke. So hyperlipidemia can also causes cardiovascular diseases, so it's important to control the lifestyle changes and medications. Now the risk factors. Risk factors that contribute to hyperlipidemia include genetics. That is, the hereditary factors are the most common cause of this hyperlipidemia. Next is age. The risk of hyperlipidemia increases with the age. Other disorders include diabetes, kidney diseases, hypothyroidism, polycystic ovary syndrome, and pregnancy may promote hyperlipidemia. Now the causes. High cholesterol may be caused by food that is high in cholesterol, saturated fat and trans fat including cheese, egg yolks, red meat, fried and processed food, and ice cream. However, there are other causes that lead to this condition. The preventable cause of this hyperlipidemia may include smoking, being overweight, physical inactivity, excessive alcohol consumption, steroid use, etc. Now the prevention. While many risk factors cannot be controlled, you can make lifestyle changes to help prevent to reduce hyperlipidemia. The first is practicing good heart health. That is, eat a diet that is low in saturated and trans fat but high in fibers. That is, eat fish 2 times a week. Next is managing weight. Maintain a normal weight and body mass index. Control diabetes, that is, take medication as prescribed and follow your physician's eating and exercise recommendations. Next is increase physical activity level and stop smoking. Now the treatment and recovery. The main treatment for hyperlipidemia are lifestyle changes. That is, the lifestyle changes needed to treat hyperlipidemia are similar to prevention. That is, regular aerobic exercises, eating a diet low in saturated fat, maintaining a normal weight, and avoid smoking. Next is medication. That is, while some people can effectively maintain high cholesterol with lifestyle changes, while others may require medications. That is, the first is statins. That is, medication can help prevent your liver from producing too much fat. Resins, this medication can help prevent cholesterol from being absorbed into the blood. Fibrates, this medication can cut down the amount of fat in the blood. Protein blockers, this medication can help make it easier for your body to remove cholesterol from the blood. Now the signs and symptoms. Hyperlipidemia itself does not produce symptoms but may eventually lead to the conditions and symptoms. However, it results in coronary heart diseases and atherosclerosis. The symptoms in adult may include chest pain, high blood pressure, heart attack, block in blood vessels in brain and heart, stroke. Now the diagnosis, which I have not mentioned in this PPT. If hyperlipidemia is suspected, we perform a physical examination and ask questions about symptoms. We then use advanced diagnostic procedures and technology to effectively diagnose, inform treatment, and carefully monitor the condition. The common diagnostic procedure may include blood test. That is, the blood test check the level of certain fats, cholesterol, sugar, and protein in the blood that could indicate the heart conditions. This may include low density lipoprotein, that is the bad cholesterol. The high level increases your risk of stroke and heart diseases. Next is high density lipoprotein, that is good cholesterol. The high level decreases your risk for stroke and heart problems. Triglycerides, these are the form of fat in your blood. Too much fat in your blood can make you more vulnerable to heart diseases. Next is total cholesterol, that is the overall combination of this low density lipoprotein and high density lipoprotein in your blood. Next topic is Gaucher's disease. The Gaucher's disease is a rare genetic disorder passed down from the parent to children. A rare and chronic contagious disease related to defective glycolipid metabolism and excessive storage of lipid substances in spleen, liver, and bone marrow. It results from the autosomal recessive mutation. The homozygous inheritance of the recessive mutant allele causes the deficiency or absence of the lysosomal enzyme glucocerebrosidase. This enzyme medicates the breakdown of lipid substances. In its deficiency or absence, cerebrosidase and other lipids accumulate in blood and the cells of retinoendothelial system, especially in liver, spleen, and bone marrow. This turn causes the liver enlargement, bone recessions, abnormal enlargement of some limb bones, severe anemia, and several neurological problems. This result turned a chronic course in adult. Now the symptoms. There are different type of Gaucher diseases, and signs and symptoms of diseases vary widely even within the same type. Type 1 is so far from the most common. Siblings, even the identical twins with the disease, can have different level of severity. Some people who have Gaucher disease may have only mild or no symptoms at all. So the most people who have Gaucher disease have varying degree of the following problems. The first one is abnormal complaints, because the liver and especially the spleen can enlarge dramatically. The abdomen can become painful, distended. Second is skeletal abnormalities. Gaucher disease can weaken the bone, increasing the risk of painful fractures. Next is the blood disorders. A decrease in healthy red blood cells can result in severe fracture. The Gaucher disease can also affect the cell responsible for clotting, which can cause easy nosebleeds. Now the risk factors. People of Eastern and Central Europe Jewish ancestors are at higher risk of developing the most common variety of Gaucher's disease. Now the causes. Gaucher's disease is passed along in an inherited pattern, autosomal recessive. Both parents must be carrier of the Gaucher gene for their child to inherit the condition. Now the complications. The Gaucher's disease can result in delays in growth and puberty in children, gynecological and obstetric problems, Parkinson's disease, cancer such as myeloma, leukemia and lymphoma. Now the treatment. While there are no cure for this Gaucher disease, a variety of treatment can help control the symptoms, preventing irreversible damage and improve quality of life. Some people have such mild symptoms, they don't need treatment. So many people who have Gaucher disease have the improvements in their symptoms after beginning the treatment with this enzyme replacement therapy. This approach replaces the deficient enzyme with the article ones. This replacement enzymes are given to an outpatient procedure with an typical high dose at 2 weeks intervals. The next is miglustat. That is, the oral medication appears to interfere with the production of fatty substances that build up people with Gaucher's disease. Eligustat. The drugs also seem to inhibit the production of fatty substances that build up in people with the most common from the Gaucher's disease. Next is osteoporosis drugs. This type of medication can help rebuild bone weakened by Gaucher's disease. The next is Tay-Sachs disease. So Tay-Sachs disease is a genetic metabolic disorder caused by the deficiency of the enzyme hexosaminase that result in the failure to process a lipid called GM2 ganglioside that accumulate in the brain and other tissue. So the symptoms. In the most common form, an infant usually begins showing symptoms by about 6 months of age. Signs and symptoms of Tay-Sachs disease can include the following, that is, loss of motor skills, including turning over, crawling and sitting up, exaggerated reactions when the baby hears loud noises, seizures, vision and hearing loss, cherry red spots in the eyes, muscle weakness and movement problems. Now the cause. Tay-Sachs disease is a genetic disorder that is passed from the parent to their children. It occurs when the child inherits the gene from both the parents. Risk factors. Cajun community, older order Amish community in Pennsylvania, certain French Canadian communities, Eastern and Central Europe Jewish communities. Now the treatment. There is no cure for this Tay-Sachs disease, but some treatment can help in managing symptoms. The goal of treatment is support and comfort. Supportive treatments include are medication to reduce your child's symptoms. A number of prescription medications are available, including anti-seizure medications. Respiratory care. The child who have Tay-Sachs disease are at high risk of lung infection that causes breathing problems and frequently accumulate mucus in their lungs. So your child may need the mucus using the chest physiotherapy to help remove the mucus from the lungs. Next is feeding tubes. Your child may have trouble swallowing or develop respiratory problems by inhaling food or liquids in the lungs while eating. To prevent these problems, your doctor may recommend it as assistive feeding device such as gastrostomy tubes, which is inserted through your child's nose and goes to your child's stomach. Or a doctor trained in stomach surgery may surgically insert an esophagogastrostomy tubes. Next is physical therapy. As the disease progresses, your child may benefit from physical therapy to help keep joint flexible and maintain as much ability to move as possible. So this physical therapy can delay joint stiffness and reduce or delay the loss of functions and pain, and that result from shortened muscles. Next is the diagnosis. To confirm that your baby has Tay-Sachs disease, your doctor will ask you about the child's symptoms and may hereditary family disorders will order a diagnostic blood test. The blood test checks the level of an enzyme called hexosaminidase in the child's blood. The level are low or absent in Tay-Sachs diseases. The next is Niemann-Pick disease. So, Niemann-Pick disease is a rare inherited disease that affects the body's ability to metabolize fat within the cells. These cells malfunction and over time die. It can affect the brain, nerves, liver, spleen, bone marrow and lungs. So now the symptoms of this Niemann diseases are clumsiness and difficult walking, sleep disturbance, excessive muscle contraction or eye movements, difficulty swallowing and eating, recurrent pneumonia. Now the causes. Niemann-Pick disease is caused by mutation in specific genes related to how the body metabolizes fat. Niemann-Pick disease mutations are passed from parents to children in a pattern called autosomal recessive inheritance. This means that both the mother and father must pass on the defective form of the gene for the child to be affected. Now the treatment. No cure exists for Niemann-Pick disease. No effective treatment is available to people with type A and B. People with mild to moderate type C, a drug called miglustat may be an option. The physical therapy is an important part of the treatment to help maintain mobility as long as possible. People with Niemann-Pick disease need to see their doctor regularly. The type of Niemann-Pick disease is type A and B and type C. So type A and B. Type A and B are caused by a missing or malfunctioning enzyme called sphingomyelinase. This affects the body's ability to metabolize fat, resulting in a build-up in fat in cells. This causes cell dysfunction and overtime death. Type A occur mainly in infants, and type B usually occur late in childhood and is associated with primary brain disease. Most people affected with the type B survive into adulthood. Type C. Niemann-Pick type C is a rare inherited disease. Genetic mutation of this type causes cholesterol and other fat to accumulate in the liver, spleen and lungs. The brain is eventually affected too. Now the clinical trials. Magnetic resonance imaging, eye exam, genetic testing and prenatal testing. That comes to the end of my seminar. So the magnetic resonance imaging means the brain may show loss of brain cells, but in the early stages of Niemann pick. This magnetic resonance imaging may be normal because the symptoms typically occur before the loss of brain cells. And the eye exam and an eye exam can show signs that may be indication of the Niemann-Pick disease, such as eye movement difficulties. Next is genetic testing. That is, the DNA testing of a blood sample may show specific abnormal genes that causes the Niemann-Pick pick types, that is A, B and C. This DNA test can show who is the carrier for all type of Niemann-Pick disease if the mutation have been described in the first persons identified in a family. Prenatal testing, that is, the ultrasound can detect the enlarged liver and spleen that is caused by the type C. And that's came to the end of my seminar. Thank you.